Welcome to the very first Sleep Divas Live. This is a really exciting event. I'm really excited. How about you ladies?
Yeah, I'm excited.
Fantastic. So I'm really glad that you can make it, those that are here live and those that are watching as a replay. I just wanted to welcome you all from wherever you are in the world and just tell you a very little bit about the Sleep Divas and why we're here and what we're here to do for you all and for us as well. So the Sleep Divas is a community for women by women to educate, inspire and support women on their journey toward a life of abundant energy, joy and wellness. Who doesn't want more of that? And I really want to encourage any of you who are watching to invite your sisters, mothers, aunts, girlfriends, daughters to join the Sleep Divas Facebook group. And yeah, it's just really important that we share the content that we are putting into this group, because we need to have more conversations and share those conversations more widely across the female community. And I just want to introduce the other Sleep Divas. Well, I'm Amanda and I'm a sleep practitioner and coach from Australia. We've also got Nishi, who is an integrative sleep psychiatrist from San Francisco, and Smita, who is an integrative sleep neurologist from Chicago. So we cover the globe quite well. And today we're going to be talking, we've only got 30 minutes, so I'm going to be talking fast, which is good for an Australian. We do that well. We're going to be talking about sleep apnea and women and why it's not just a guy thing. I mean, I remember for years thinking, well, it's really just for large men, and it's so not the case, which we'll discover today, and why it is that, and why it's important for us to recognize how to identify sleep apnea and what we can do about it. So again, whatever you learn in today's session, whether you're watching it live or back as a replay, please share that information when you're chatting with your girlfriends. So without further ado, over to you, Smita.
Hi, welcome, Sleep Divas, and we're excited about a discussion today about sleep apnea and why it's not just a man thing, because clearly we are different. Women have different symptoms, and we have different things going on in our bodies. And so briefly, sleep apnea. Everyone may know what this is, but just to clear out the definition, is when you're sleeping, you stop breathing. So that's what sleep apnea is. Now, you don't just stop breathing, just like, 10 seconds, something like that, just once. It typically happens frequently throughout the night. And so, we wanted to try to understand what that means for a woman, right? Do women stop breathing in their sleep? And when are they more prone to it? Why do they do this, right? Like, that's what we're going to try to talk about today. And when, like Amanda was saying, when you think of sleep apnea, you think of loud snoring, stopping breathing, maybe, large man, thick neck, overweight. But, women can still have sleep apnea and not have those things. They don't have to have a large neck, and they don't have to have loud snoring. And that's why I think it's important to talk about this, because women kind of come in with different symptoms, a different presentation, because we're not just little men. So remember that. We, might come in with a headache, or we might come in with mood problems. We're cranky or depressed, or maybe we're anxious, or maybe we just don't sleep. Maybe we don't sleep through the night. So I think, our presentation, women's presentation, is a little different, and therefore we probably get more diagnosed with depression, or look at that crazy woman, as opposed to an actual problem, something like stopping breathing in the night, which is impacting how we function during the day. So, what I also want to talk about is a little bit about the sleep study, because I think that's important to know when we talk about sleep apnea. The sleep study is, of course, many people think of all these wires on our head, and that is true, for the in-lab sleep study. And then there's also the home sleep study, right? So this is where we can figure out how many times do you stop breathing with one of these types of studies. And what's important to note for women is that we might not stop breathing as often as men. So, that's the other problem, right? Because we didn't fit into the same box as men when they were making these rules up, means we don't get the proper diagnosis. And so what I want to explain is that staging, that how do we score? And then we'll talk a little more in terms of with the other sleep divas here, okay? So when we stop breathing, like I told you, it could happen just once, but typically when we diagnose with sleep apnea, it's happening multiple times in the night. And what we're measuring is how many times. So we measure your apnea hypopnea index. That's a big word, AHI. But anybody who's had a sleep study might know that we want to see what was your AHI, and that's basically the number of times that you stop breathing in the night per hour, right? So you might stop breathing 5 times an hour or 30 times an hour, and so based on this number, we kind of give a severity level. Are you mild? Are you moderate? Are you severe? And again, I just want to go back to that this number doesn't matter if you're mild, moderate, severe, but women may not make the cut to call it an event, to call it a stop breathing. And so therefore it's not even counted, or it's counted very minimally. And therefore, you don't add up in terms of getting that score, but it's still happening. And so that is part of the reason why women can be misdiagnosed and then therefore not get the treatments they need, and instead being called, that crazy lady. So, we also need to take into account other things like hormones and the size of our neck and the amount of fat and all this other things. But so let's start with a discussion just with what I've said so far, so we can kind of intermix this a little bit.
Thanks, Smita. I have got so many questions I've been writing down. That was really interesting. I didn't know about the misdiagnosis. I've got a couple of questions about the sleep study and the diagnosis of sleep apnea. And the first one is, you talk about the number of times that we stop sleeping during the night. How long is a typical, sleep apnea episode? Is it seconds? Because I've got this sense that surely if I stopped breathing, I would know about it. I'd be like, wake up in the middle of the night. So can you just talk a little bit more about that?
Yeah, so the official criteria is 10 seconds.
Okay.
So, when you go to see your doctor and they ask for a sleep study, the sleep specialist will look at your sleep test and will count any time you stop breathing for at least 10 seconds. Okay. 10 seconds doesn't sound like a whole lot. Maybe when you're doing a plank, it seems like a lot, but yeah. Otherwise it doesn't seem like a whole lot. So, but that is the criteria. So again, if it's just one episode of 10 seconds throughout the night, you don't have sleep apnea. But if it's happening consistently throughout the night, that's when we would start counting it up and seeing what your AHI is. Like, what is that hourly index?
Yeah. And I presume that, most people with sleep apnea, or most women with sleep apnea, they don't know that they've got it. Like, it's not something that you're aware that you're stopping breathing.
Well, again, it goes back to, I might not snore, or I might very mildly have some snores, or who's listening to me? My husband is like dead asleep, right?
And snoring.
So, maybe I'm not snoring until the middle of the night. And then by that point, everyone's asleep. And so, it's hard to pick up if no one's like watching you sleep, and that's part of the sleep study, right? So the job of the technician is to stay awake and pay attention to what's happening, to all these waves of data that we get on a sleep study.
Wow, that's brilliant. Now, just before we go to you, Nishi, with a question, I'm just going to invite anyone who's watching now, and if you're watching as a replay, please post a question in the chat. And if you're watching as a replay, please just hashtag replay so we can come back and make sure we answer your question. So I wanted to just also ask about the consequences of sleep apnea, because I know for a lot of women watching, and me too, I'm a snorer, and I fit into that category exactly as you just described, Smita, which is I don't snore straight away. My husband, he'd hate if he heard me saying this live, but he snores. He snores really loudly. I sleep every night with earplugs when we sleep together. If he's away, I don't. And he says I snore, but he only knows I snore when he wakes up in the middle of the night. I snore in the middle of the night, not at the start of the night. So I think there's so many women who do snore. And of course, that is an indicator that you may have sleep apnea. Can you just describe why is it so important? And we've talked about being cranky, but there's some real health impacts here, isn't there?
Yeah, Nisha, do you want to take this one?
Yeah, absolutely. So there are actually far-reaching impacts of untreated sleep apnea, and it can run the range of just impaired, daytime concentration and just affect your day-to-day, experience of life. You could feel tired, sleepy, not have the energy to do the things that you need to be doing or want to be doing in your, everyday life. But it can also contribute to specific medical conditions. So an increased risk of cardiovascular disease is one of them, and high blood pressure, heart disease. Stroke is also at a higher risk for people who have sleep apnea. And what's so interesting and important for women to know about this is that even when women have less severe symptoms of sleep apnea, they're at a higher risk of having those severe medical consequences of untreated sleep apnea. So their symptoms of sleep apnea might be, misdiagnosed, they may be undertreated, or they might be even told it's mild. But there's actually data showing that when women have an AHI that Smita was talking about, the apnea-hypopnea index, an AHI of between 2 to 5, which is considered not sleep apnea. More than 5 is considered sleep apnea. But when women have a level of 2 to 5, they may have equivalent consequences of a man who has an AHI of 15 or higher.
Wow, that is so significant.
Really significant. And this is why it's so important for women. Yeah. They also have a higher risk of depression. So I see this a lot in my clinic as a psychiatrist. So I see people with depression, with insomnia, with anxiety that's not getting better. And I have a very low threshold for screening and testing for sleep apnea, especially in my female patients, because I've seen loads of women who have sleep apnea where it hasn't been diagnosed. Maybe they were diagnosed with fibromyalgia, chronic aches and pains, or chronic fatigue syndrome, when it was actually a sleep-related breathing disorder like sleep apnea. So it can contribute to these mental health conditions as well. And so this is why, we're emphasizing that this is so important for women to recognize, because your doctor might not even think about it in the differential diagnosis when they're evaluating you.
I think that's really important. And I think, again, sharing it more widely amongst the women that we know that we do have a difference in the diagnosis. And many GPs, general practitioners, may not have that awareness. So, Nishi, you mentioned you have a lower threshold. What is that threshold? Are you using 5 or lower for women in your practice?
So that number comes from the sleep study. So, I would have to send somebody for a sleep study to get that. But when I say I have a low threshold for screening, what I mean is that if a woman comes to me with depression, with chronic fatigue, with insomnia, or just never feeling rested, like if she just wakes up and she's like, oh, I'm tired all the time, medications aren't really helping with depression, other interventions aren't helping, then I would say, well, let's just go ahead and get a sleep study and just get a closer look at what's going on, even though they might not have symptoms of snoring, or they might not even think they have issues with their sleep. So I can share an example of one of my patients where we found out she had sleep apnea. So this was a woman in her early 40s. She was tall and slender, very thin, not somebody you would classically think of as having sleep apnea, right? So not the
Yeah.
overweight girl with the big thick
Yeah.
neck. And she had issues with gastric reflux, acid reflux, and it just wasn't getting better. And she's being sent from specialist to specialist. No one could figure out what's going on. She had this chronic cough. And then she also has these issues with depression and concentration. So I suggested to her, let's get a sleep study. And indeed, she had sleep apnea. We got it treated and her symptoms improved. And this is not something that would have been picked up on before. So that's what I mean when I say I have a low threshold, that, if there are unexplainable symptoms like fatigue, problems with concentration, depression that's not getting better, or even physical symptoms that are unexplainable, like aches and pains or acid reflux and headaches, migraines, things like this, then it's worth getting a sleep study.
Wow. Just on the sleep study, sorry, Smita, can I just ask, because, there are different types of sleep studies, and I think it's important just to very briefly touch on this. Maybe, Smita, you might like to answer it around, and you mentioned the home sleep study. Of course, the gold standard is the in-lab hospital polysomnogram, but we can do sleep studies in home, and there are different types of sleep studies that you can do in the home. One that you can take home and fit yourself, and there are some in which you go to a practice, and then they fit you with the various electrodes and you drive home in this strange state. Can you just talk to us a little bit about the reliability of those different sleep studies in terms of sleep apnea?
Yeah, I mean, we really just kind of differentiate between a home study and an in-lab study. While there are different types of, different companies that make home sleep testing, just for easy, information, a home sleep study versus an in-lab sleep study. And the fact that, many people who have symptoms do qualify for a home sleep study, and therefore, can easily be tested in the convenience of your home, right? And that's, like sometimes you feel that you're in this other bed and have all these wires on, and how am I going to sleep? And is that person out there staring at me, right? So, I mean, those are the common thoughts. Of course, so having a home test, if you qualify for that, can be done, and it's easily dispensable. And so, depends again, how specific the symptoms are and the criteria and things. But, I don't want you to get too overwhelmed with that part of it right now. I think we just really want to make sure that you're aware that, sleep apnea can happen to women, and therefore, we need to just keep that on our radar, because we need to not get a stroke. I also want to bring up that hormones play a big role here too. So when I was pregnant, long ago, when I gained all my weight because I was pregnant, I did snore. My husband did tell me that at that point that I am snoring. And the other scary part is that I was driving and got into a little fender bender. So again, just not getting proper sleep can like a little, nobody got hurt. I was fine. Baby was fine. Other person was fine, but I had one of those like probably micro sleeps, and thought I had my foot on the brake, and I guess I didn't, and so it was kind of a little bit of a rolling thing. But, obviously I got very lucky, but accidents can occur when we're not getting proper sleep. And that could be a possible symptom, is to kind of investigate, what happened there? Well, how am I sleeping? How do I feel? How do I feel during the day? Those are all deep questions that, we should be asking ourselves as women, and trying to figure out, am I moody and tired because I have a sleep problem? And today, like I said, we're talking about sleep apnea. So are hormones involved, in menopause? Are we losing hormones, and is it impacting our airway? So maybe, you didn't snore or have any problems before, but once we hit a certain age, or, certain milestone, pregnancy, menopause, any of those other things in between, can impact our ability to not breathe right.
I think that's a nice segue into a discussion around what are some of the predisposing factors. So, of course, alcohol, any sort of sedative is likely to increase the chances of sleep apnea. I also had the question around obstructive and sleep apnea and sleep apnea, because there's other types of sleep apnea, of course, where your brain has, isn't sending the signal to the breathing muscles. So we're talking about obstructive sleep apnea here. So what about the predisposing factors? So I know if I've had some alcohol, I will, and I can attest for my husband, when he drinks some alcohol, his snoring is off the radar, and I'm sure mine is off the Richter, I should say, the Richter chart, not radar, and mine too. I know I snore more when I've had some alcohol. I don't take sedatives, any other sedatives, but I know they are things that increase the likelihood of sleep apnea. What other things? We've talked about, as we get older, we've talked about increased weight. So that's a larger neck size. What other things can we look at that might just be a little bit of a warning sign that we are more likely to experience sleep apnea? Nishi?
So definitely, yeah, sure. So as Smita alluded to, so pregnancy is one risk factor, and that's partly because of weight-related changes, but also hormonal changes that happen as well during pregnancy, and can put women at a higher risk of having sleep apnea. So that's one sort of time period to kind of be aware of, and just kind of be alert to the possible symptoms, and talking to your doctor about potentially testing during that period of time. The other one is also, as we discussed as well, is menopause and after menopause. So there's a huge jump in rates of sleep apnea after menopause. So before menopause, men do tend to have more sleep apnea than women. The rates are higher. There's actually some conflicting data on how much higher it is in men, because it's been typically underdiagnosed and misdiagnosed in women.
I was about to say that. Yeah.
Exactly. Yeah. So, but we do know that after menopause, the rates are pretty equivalent to that in men. And again, this is partly because of hormonal changes. So it's thought that progesterone helps to kind of keep the airway open a little bit. And some of the changes that happen hormonally make the airway more collapsible, thus increasing the risk of sleep apnea. But it's actually not quite fully understood. It's not that simple. There are other factors as well. And then those weight changes too. But other things that I look for in my clinic, as well as you mentioned, are, alcohol use, but also certain medications. So if patients are taking medication, people are taking medications that could make their airway more collapsible, that's something to address. Sometimes people, can go off those medications safely, with their doctor's guidance, and that can help alleviate the symptoms. But if that's not possible, then, sometimes treating the sleep apnea as well is good to do. Even small fluctuations in weight can have an impact. So when we talk about the weight-related, increased risk of sleep apnea, it doesn't mean that you now, suddenly you have to gain 20 pounds to develop sleep apnea. That's not the case. For some people, it can just be a few pounds of weight that increases their symptoms. And I have some patients who they know that they've gained maybe 5 pounds, and they know that, oh, I'm developing sleep apnea. They can tell just because they're sleepy during the day, or they're snoring, or they're having trouble concentrating, or they're just not as rested. And so they'll actually work on weight loss, and that can sometimes alleviate the symptoms. So there are loads of different factors to consider. Another one is family history. So if you do have family members who have it, then you may be at higher risk as well. And then for other people, it's the structure of the airway. So, we've been talking about how thin, slender people can also have sleep apnea. And that may be because there's an obstruction at the level of the nose or the level of the throat that just makes the airway more susceptible to collapse. And in women, like we were saying, they tend to have lower severity of sleep apnea, but with significant consequences. Many women also have something called upper airway resistance syndrome, which is kind of the sub-threshold of sleep apnea. It's when you have an AHI less than 5, and that can have to do sometimes with the structure of the airway.
Terrific. And also smoking, that increases the incidence of sleep apnea as well. Now, you were talking about weight, and I'm just looking at the time. Weight in terms of, it's just a slight increase in weight can increase the the chances of sleep apnea, I imagine that works in reverse. So when we're looking at the treatment options, and I'm sort of looking at the 5 minutes to go, looking at the treatment options and what we can do as women, because of course CPAP machines are the first line of call for many people in their minds, at least. So, oh my God, I'm not going to go there. And I think that really puts people off from going and getting the diagnosis of sleep apnea. I know I would. If I think, I snore. So if I wanted to go to the GP and, well, what do? Well, if I know that my only route for a therapy is CPAP, I don't think I'm going to go there, not until they change that machine and I'm not looking like Darth Vader. So absolutely, I think the weight side of things, and I'm not sure, I haven't got any data around it, but is it the same that, just a small decrease in weight can have an impact on your improvement in breathing at nighttime?
So to answer your question, Amanda, yes, a small decrease in weight, can fix someone's issue. But to be a little funny too, is that the CPAP machines are usually the same, but the masks they even make for her, right? So again, we're not just little men. We have masks that are slim fitted and fit our nose and structure of our face. So if CPAP is the choice of treatment, they do design them for women too. So just throw that in that.
Yeah, thank you. That's a really good one. Anything else, like in terms of therapies, what else is available for people who are looking at a diagnosis or considering getting a diagnosis of sleep apnea?
Yeah, so the treatments are not just the CPAP. As Smita mentioned, CPAP, there are CPAP masks for her. And, with CPAP, it actually helps people lose weight sometimes, because when you have untreated sleep apnea, it's harder to lose weight. So I have seen this happen where people don't want to use the mask. They don't want to look like Darth Vader, like you said, but sometimes using it, even for a short period of time, can help them lose the weight so that they don't need to use it anymore. But another, option is something called an oral appliance or mandibular advancement device, which is like a retainer-like device that you wear in your mouth, and it kind of gently pulls the jaw forward to open up the airway space. So that's a pretty unobtrusive, sort of, easy to use treatment for many people, but you do have to be evaluated to see if it's appropriate for you, because the configuration of your jaw is important and your dentition, etc. So that's an option as well. There's some interesting data on breathing practices. We've talked about the didgeridoo.
We have.
Playing a wind instrument can sometimes help strengthen and tone the airways. So, these are conversations for people to have with their doctor to see, what's appropriate for them, because the treatments can be really personalized to people. And as sleep doctors, we take that into account to see what people want to use, what are they willing to do, and, how can we create a treatment plan that is going to be feasible for them.
And I think as we get more information, as we're paying a little more attention to women in these sleep studies, and the fact that, that this information is coming more to light, I think we'll be able to personalize it even further. So I'm really, excited about all that's coming up in the future.
Yeah, I agree completely. I think it's a constantly changing space. And what I'm really buoyed about is that there are other options. I'm buoyed by the fact that, there's this recognition and growing recognition that sleep apnea in women is very largely undiagnosed, but it has an even higher impact. I think that's a real takeaway for me today, a really higher impact on women than on men at those lower levels. It can, although they're not showing it as as being a diagnosis of sleep apnea, yeah, the impacts are huge, and we need to sit up and take note. But the other thing that really was nice to hear, Nishi, is the fact that you might not need it forever. If it's about weight gain, the weight loss, whether you wear the sleep apnea machine for a short period of time and achieve that, that's just brilliant. And I think also, if you truly are struggling through the day and it's impacting your life, if you try a CPAP machine, if that's your go-to, even for a short period of time, I think the benefits that you would feel would be profound during the day. Like it would be like, oh my God, I've lifted from this fog, I've come out of the forest type of thing, that you would probably ignore the Darth Vader. I don't care what I look like, as long as I can get that feeling again during the day. So any final comments before we wrap up?
Yeah, I'd like to add one more thing, which is that, so because the symptoms are more subtle in women, one negative sleep study doesn't mean that you don't have sleep apnea. So I tell this to people that I work with that, they'll come back and say, well, my sleep study was negative, but sleep apnea can vary from night to night. So, if it's negative, but you're still having symptoms, it's worth having a conversation with your doctor to see if it's a good idea to do another sleep study at another point in time, because one alone is not always diagnostic.
Yeah, I mean, just using your other patient that you mentioned as an example, right? I mean, if she didn't get her reflux diagnosed, she would have been on, I mean, if she didn't have the sleep apnea diagnosed, she would have been on reflux medications for the rest of her life, right? So, so just kind of like thinking about, are you on an antidepressant for the rest of your life, or are you on a reflux medication for the rest of your life? So I think, I like that you do, encourage your patients to come back and get retested and staying open to that fact, because again, I know nobody wants to have a diagnosis. Nobody wants to have anything, but and the reality is, if it's happening, you don't want to hide it. You want to, you want to approach it, and you want to try to take care of your health and just have a better quality of life. So, again, me realizing I got into a little fender bender, I wanted more clarity. I wanted to be more awake during the day, and kind of using that as my own example. So, sharing that with other women.
Thanks, Smita. That's really great. Wow, we've hit the 30-minute mark. So I just want to say thank you both, everyone who's watching live and coming back into the group to watch it as a replay. Thank you for joining us. The replay will be posted in the guide section of our Facebook group. That's the Sleep Divas Facebook group. If you're watching on YouTube, which we will post it up there, please come and join us in the Sleep Divas Facebook group. And I also wanted to just do a shout out. We've got the next live on the 28th of April, and we'll be talking about supplements. So that will be a really interesting topic. I don't know how we're going to get that in 30 minutes, but we'll have to be strict. And also there'll be a downloadable in the first comment or two, which is all about sleep apnea, just a one-page download. If you're interested, go and have a look for that. So thank you so much, everyone. Have a fabulous day.
Thanks.
Bye.